Good afternoon, everybody. Hopefully you had a nice weekend. Let's just go over some of this here. Okay, so good news. No new deaths over the weekend. So I think we're on a nice positive trend there. I'll talk a little bit about that in a minute. 7-day rolling average, 1.5. That's kind of where we've been. I think as long as we're stuck with this 80 to 100, 110 on average cases, we're not going to get any lower than that. Now that's half of what the state average is, and it still is the best out of any large county in the state, but I think there's a couple things that are causing where we are, and it just may take time for us to be able to get through that next tier. We've now had 35,259 positive cases. That's 55 new cases. The trend's pretty consistent now. Over the end of the week, over the weekend, we have high case numbers. In the beginning of the week, we have lower case numbers. So on average, when you average them out, a lot of that has to do with the timing of testing labs coming back. You're looking at that 80 to 100, maybe a little over 100 case range per week. Active cases are 688. One of the things that I think people should just understand that the virus is still here is we are now seeing the active case percentage that we saw earlier this year with hospitalizations. So hospitalizations went up to 59, and so that's 8% of the active cases. That was kind of like clockwork throughout the whole pandemic, is whatever our active case number was, you saw between a 7 and 10% hospitalization number. That was not the case for a period of time. But it looks like certainly that's back to where we are. So we need to continue to respect the virus. 12 residents are in the ICU, so please keep those 12 residents in your thoughts and prayers. We've had better outcomes, quite frankly, just because we have younger people who are essentially attracting the virus. So that's essentially why we've had better outcomes related to loss of life. The vaccinated populations, and we're going to get the specific numbers for Thursday of what percentage of the population over 90 has been vaccinated, over 80, 70, and 60, because those demographics just don't represent a large amount of our cases, and so therefore they don't represent a large amount of our hospitalizations either. But you can be young and get sick and go to the hospital. I think that's just the message everybody needs to understand. And that's just not a spot where you want to be. So let's continue to be smart. It also means that we need to really look at the vaccine, and it's very effective with these groups. And if you're having hesitancy, it's working. People aren't getting this virus who have been vaccinated. So I think that's important for us to realize. Related to the vaccine numbers, we'll be over 220,000 first shots today. If you look at eligible population, it's 360,000 roughly. Total population, 462 to 67,000, depending on whose number you like. So we're approaching, by the end of the week, we'll be at 230,000, which is about 50% of our total population. But out of our eligible population, it's about 64%. So we're approaching some pretty significant numbers. When you look at what's gone on in Israel, 60% total population, they really started to see the herd immunity open up. I think whether that we need to get higher, probably, but we're getting to some significant levels here, and therefore things are slowing down. It's harder to get the demand where we need it now. Today we have a first dose Moderna clinic. I think it's probably running down right now. To give you an idea, we used to do about 1,800 of these shots. Now we're doing about 600 for a clinic like today. We'll do on Thursday, April 22nd, at the On Center, we will do another Moderna clinic. And this week, we will be at ESM High School tomorrow. We'll be at Lafayette High School on Wednesday. where we will have 4 other high schools participating. We will have Lafayette, Onondaga Central, Fabius Pompey, and Tully. And then we'll be at Liverpool High School on Friday. By the end of next week, we will most likely have been to, our goal is to be to every district in the county so that they have the opportunities to have their 16 and 17 and 18-year-olds vaccinated. On Friday, in addition to being in Liverpool, we will be at the Abundant Life Church for a pop-up clinic as well. I think going into next week, our goal is going to be to get to all the high schools, and then we'll start doing more pop-ups in the community. But I think after that, we will be doing pretty much community outreach in zip codes in areas where we'll have to get creative, and you'll probably see less of a clinic here at the On Center, maybe once a week if we're having a large second shot day. But you know, to get to that 70%, 75% eligibility number right now is important, and certainly if we can get to that 60% number for our total population before things really open up to young people, I think we'll be in pretty good shape. So testing demand is really dropped off, and so we're like everything, we pivot with this this virus. So when testing demand slows down, we'll slow down some of our options. That doesn't mean there aren't numerous community options, but it doesn't make sense for us to have testing open for 5 or 10 people at a facility when they can go to other places to get the test. At the regional market, we're going to end the symptomatic testing. They need to use their facility again. Right now, we don't, quite frankly, need it. There's testing at both the fairgrounds and community hospital campus for symptoms, as well as your urgent cares and well nows. So certainly, if you're symptomatic, you still have ample places to go where insurance is going to cover you. Asymptomatic testing, the On Center is going to be open 4 days a week. We'll work to accommodate days where there's also community events so people can go and get the rapid test. Our community testing sites, I'll go through this week, but again, based off of participation, next week they may slow down. It doesn't make sense for us to pay 4 people to go work at a site that's going to do eight tests in a day. Demand's going to determine where we go with this. But again, today we're in East Syracuse Village Hall. Tomorrow we'll be at the Northeast Community Center and the Lafayette Community Center. Wednesday, Skaneateles School District offices. Thursday, Onondaga Town Hall and Shove Park. I know there is a SU Women's Lacrosse game on Thursday. If you go to one of these spots, they'll email you your result so that you can have that and go up to the Dome. Friday, Town of Clay Senior Center in Fayetteville Village Hall. And again, register for any of these appointments on gov.net. Today we opened up our emergency rental assistance program. It's on our homepage on our website. Going into this briefing, we already had 600 applications that had been submitted. So that's good to see. We'll work through all this and try to get the money out the door as fast as we can. Tomorrow, I want to thank Chairman David Knapp. He worked with multiple farmers and members of the food community, and they have a food box giveaway tomorrow, 1 p.m. at Shoppingtown Mall's parking lot. So again, thank you, Chairman Knapp, for that. And then again, a reminder, Thursday, libraries go open 9 to 5, Monday through Friday, that we manage. So saying that, happy to take questions.
So as you mentioned with the vaccine appointments slowing down, do you have a concern that we won't be able to reach herd immunity?
I don't think so. I think we're, so if you look, the good number that I look at is your eligible population. So we're, at the end of the week, I think we're going to be at 64%. So I think if we get the 12 to 15-year-olds at the end of the month eligible via the Pfizer vaccine from the FDA, I think we'll get to that 70% with that demographic. So the virus right now is most likely the UK variant. It's probably just what we have now. We've seen that with some of the testing that's happened. So it performs like the old strain we had, but it's a little bit more contagious. So what you see now is if it gets into the household before you had a fighting chance to isolate and quarantine your child or the adult who is sick, and the other members of the household had a chance to maybe not get it. That's not the case now. Essentially, if it gets into the house, unless you've been vaccinated, you're going to see your siblings will get it. So we're seeing that. So parents obviously, it's going to be their choice with their kids getting vaccinated, but this thing's happening with 12 to 15-year-olds, and then the little ones get it, or vice versa somehow, right, with socializing and whatnot. So I think once that eligibility opens up, we'll get to the 70-75% we need to be at. And again, especially when the second shots in these younger demographics start to happen, and then your 2 weeks after that, I think we'll be in a better spot.
And what are your thoughts or comments to, people who may either be hesitant to get the vaccine still, or maybe they're just choosing not to get the vaccine at this point?
Some people won't, and I recognize that. I hear from those folks. But for people on the fence, this is our tool to get our lives back, to get our liberties back. The faster we can starve this virus, the faster we'll be able to make the case to the larger governments to reopen up our lives the way we used to have them. So this is the tool. Let's use it. If you have any questions, our health department's happy to talk to you. You can talk to your own doctor. And certainly we have not seen, I have not been briefed on any bad outcome here in Onondaga County from a shot. So these are good tools. I've been vaccinated. My family's been vaccinated. My staff's been vaccinated. It's important that we do this. And if you're hesitant because of some of that, let's figure out how we can get past that. Some people aren't going to do it, and that's their choice, and I respect their position.
I know there were some nights that the staff here at the On Center were calling lists through their phones, trying to get rid of a few shots left over. I imagine, based on the numbers you gave, there's ending up to be a lot left over supply at the end of the day. Have you lost any vaccines yet from that? And it'll become a challenge now to use up every dose. How do you plan to do that in the coming weeks as the demand continues to go down? Yeah,
so well, it'll just be like everybody else, right? You'll just have some, supply in the shelves, and so we have the proper infrastructure to keep all the vaccine. We do have a bit of supply now with Pfizer and Moderna coming in. So what we may do next week is, if we still have a lot of supply, we may say we don't need any vaccine that week. The tool we really like right now to have, because it can go to 16-year-olds, is the Pfizer. But we do have Pfizer and Moderna. We're getting more Pfizer in this week. And eventually we still have J&J. So if Friday the FDA says we did our study, J&J is okay, then that's a tool that probably will be helpful in some communities. We still have some demographics that we know are going to be here. We're going to have migrant farm workers coming through the community soon, and different folks that we know we can still get to. But it's going to become more challenging. Our pop-up clinics, used to be 250 to 400. You're going to look at 50 to 150 person pop-up clinics, and it's just going to be that way moving forward. As we get to that, try to grind it out to 70-75% numbers in both the total county population and then obviously the eligible population.
Have there been doses you haven't been able to find someone for? Have you lost any?
No. I mean, it just goes back. Our team's very good at not opening up things that you don't need, right? So there's, but yeah, that just goes back into the freezer.
A lot of the focus on the governor's end, on your end, has been getting into minority communities, maybe people that won't even come to the On Center. You've done that already. So what changes? What other communities out there? Do you go to these communities more often? Are there communities you haven't gotten a chance to get to at all that you can shift to? Like, who's left?
Yeah, so So there's zip codes, we know by the population that there's people there that just haven't gotten it. So I think then you look at how many adults are in that out of your eligible pools, and what are some different things we can do to get them. We're going to be in neighborhoods, Andrew, so we'll probably have walk-up clinics in a couple weeks here. We'll work with credible messengers again. Use reverse 911 calls going to people's homes saying, come by and just get a shot. We may have people on the streets recruiting people to get shots. So these are all things that we'll do. We'll go into rural communities that we're starting to see some hesitancy, and try to offer that same type of model into the rural communities to see if that helps. I don't know if it will, but we'll try. And then we'll continue to work with credible messengers. We focused in on the city. Now we're starting to go to some of our credible messengers out in the suburbs, in faith-based leaders. So we'll start to really do that as well. I think if we can do everything we can over the next 6 weeks, I think we do what we need to do. Then the question is, do we need booster shots later on in the year or next year?
Have you used the reverse 911 concept yet?
Not yet. Not yet.
Have you done sign-ups at Abundant Life, or is that a walk-in?
We have registration for that, Ann? Yeah. And and again, those types of things you have a registration for, but your faith-based leaders are always working on their congregation and get people in and out, so that's kind of an evolving thing. We will take walk-ups.
And you said there are about 600 people who signed up today?
Yeah.
And you could have taken 1,800?
Correct.
I know your gift card program goes to the customer side, I believe, starting tomorrow. Would you talk a little bit about that and that rollout, encouraging people to basically take advantage of a free meal?
Yeah, I think with what we're starting to look at it, with just our administration's goals moving forward, is we end this pandemic and we continue to vaccinate and do what we need to do on the public health side. But now we start to focus in on the economic clusters or the hospitality, tourism that have been just impacted horribly, right? So one thing we can do to encourage people to get out and go to their favorite restaurant, which will help them, right? And the restaurant is our gift card program, so we'll roll that out tomorrow, and we're excited about that. We think it'll go fast.
Do you have any sense yet of how quickly you'll be able to get the rent relief checks out?
So we have we have at least, I believe, 13 million on hand out of the earmarked 23. I would have to check with our CFO if we got the other 10 in yet. But certainly we'll be going through these applications, making sure there's some geographical balance, and then obviously trying to focus in on the mom and pop landlords to help them first. Not saying we won't do some. I heard from some of the larger landlords saying, what about us? You'll get help too. But then we'll start getting checks out. So we want to get money out the door as fast as we can to solve some of these issues.
Do you think processing those is like a matter of days or several weeks?
I think it's going to take us at least a week to review the initial batch to make sure we're doing things in a strategic fashion.
What are some of the restaurants taking part in the gift card program?
There's a lot of them, Andrew. I think we have over 150, and then already signed up now. So all local owned restaurants. We didn't do any national chains. So the great opportunity to support your favorite local restaurant, get out with your family, get a meal, and if it goes well, maybe we'll do it again.
And talk about the idea that cash flow is really what it's literally stimulus. You hear stimulus a lot, that money goes to more of a program. This is actual stimulus. It's a rotation of money.
Yeah, it's over $1 million, right? So, because it's $500,000 and $500,000. So it's over $1 million going into restaurants. If your family's like mine, when you go out and you have multiple mouths to feed, you either get a very big gift card to cover this program, or say you got a $50 and a $50. If I go to a restaurant with 5 or 6 people, I'm usually spending more than $100. So it's actually more than $1 million. stimulus. So that helps get things going again, right, and builds up some momentum. For us too, we make sales tax on this, right? So we're gonna, get some of our money back. Other questions?
The idea that you can shut down symptomatic testing, I mean, that's got to be momentous. That's been the crux of this pandemic for 14 months now, is that symptomatic testing, sick people saying I need a test. I mean, to shut down your side of that must feel great.
Yeah, it's an interesting feeling, Andrew, because it's you don't want to check off the box, mission accomplished, because we've been through this before and we had another wave. But what we didn't have in November and October was the vaccine. And so things are different now. If you look at our cases again, same trend today. Under 40, you're looking at 78% of the cases, and when you go under 50, it's even more, and then under 60, it's even more. So your 60-year-old and above population, which has really paid the price of this pandemic, is just there's very few cases. So that's different. So again, we've built up the infrastructure with our teams that if we had to reactivate it, we could. But it's nice that some of these people get a break, and it's nice that the demand's down. That doesn't mean the virus is gone. It's still here in our young populations, specifically, and in our 50 to 59-year-old men. Just saying, guys, it's still flying around those populations too. So, but not to have a team there every day. That's a nice way of looking at it.
Does it concern you that there may be longer wait times at some of these testing sites now? I mean, we know a family who waited nearly 2 hours today.
At a test site? Well, what of our community sites? The rapid tests? Yeah. Yeah, I mean, I have never heard that, but the reality is you usually don't get a test and get a result that day, especially if it's a PCR test. But geez, that would mean if that was in East Syracuse, that means there was a lot of people there getting tests, which we have not heard that. So, I think it's the demand determines the infrastructure we're going to put in. Again, I can't justify to the taxpayer we're going to pay 4 people to go work at one site to test 10 people over the course of 4 hours. So if demand picks up, we'll pick up.
Could you reiterate what the testing protocol now is here at the On Center?
Yeah, so we're going to do 4 days a week. We've been doing Saturdays and then 3 weekdays, and then same thing you see. It's the antigen rapid test. One thing that we will do on days where there's events is we will either print a receipt or email a receipt within the time fashion they need the receipt in, right? So some of this testing is going to be, I got to go to a wedding and I haven't been fully vaccinated, so therefore I need a test. They can come here, get the test, we get the result. We'll either print it out for them if we have it, or if not, we'll email it to them and they can go print it out.
So is it the same 4 days every week?
Essentially, right? Is it Monday, Wednesday, Friday, and then Saturday? Yeah. Other questions?
Are you worried about the positive test rate going up, or are the numbers of tests going down enough that will skew the...
I think we're kind of at the point where we took like a little hit, right? So you started to see things open, the weather change. We had some events in the community that certainly triggered more activity, more gatherings, and then that triggered a little uptick. I don't think we're in a position, Tim, that Western New York or the Finger Lakes has been through. The Finger Lakes is about a 3.2% positive rate. Western New York's higher. We've vaccinated more people percentage-wise than they have, and we just have never gotten into some of the problems they've gotten into. So if you look at where we are from a region, we're the second best in the state in Central. The Southern Tier, which doesn't really have the populace that we have, is better. But you know, Mohawk Valley, Capital District behind us, but, you know, we're doing pretty well. I think part of what's going to help us is the weather's going to change, and that's going to help us. But and that gives us more time to vaccinate to get to these numbers. But where the virus is, it's in the communities that haven't been allowed to have been vaccinated for a long period of time. And so once we get through the first and second shot, that 2-week process, so you're talking about a 5 to 6 week process. Once we can get through that, and then I think you're going to see the virus get weaker, but it's still going to be around. And I think you're going to see it around in the younger community, right? The kids, and then once we can get to the 12 to 15-year-olds, I think that's when we really get to a point where this thing's really on the defense, because your 12 to 15-year-olds are social. They're not as social as your college kids, but they're very social still. So there's more opportunities for it to spread. But we've been at this 1.5, 1.4 for, what, 3 weeks now? I mean, we were lower before then. You saw, you know, that basketball run, certainly indoor gatherings, not just on colleges, everywhere. You know, the virus finds it, it goes. And really what it is a lot of the increase is the household contacts. So you're almost guaranteeing if it gets into the house now that the household's going to get it. Whereas before, it wasn't like that.
Are you aware of any cases of someone vaccinating getting the virus?
It hasn't been brought to my attention yet. It will eventually happen, right? So, but it hasn't been brought to my attention. Other questions? Thanks, everybody.